Hi, this is Dr. K.K. Agarwal, Senior Interventional Cardiologist of R N Tagore Hospital, Mukundpur. I am here to send you a message regarding the COVID-19 vaccine. COVID-19 vaccine should be taken by everyone, whether he is a whatever age. If he is a 45 or 60 plus, he should take. Yes, you need some precautions. Those who already had a CABG bypass operation, what we call the bypass operation or angioplasty, those who are on the aspirin and other antiplatelet drugs, they can take their injections without stopping the medicines. Those who are on the anticoagulant drugs, after the valve replacement, they should stop the drug for 2 to 3 days. Keep your INR around 1.5 and then you take your dose. If your pressure, you are a diabetic, you are hypertensive, you can take the injections, but only after controlling the diabetes and the hypertension. This is disease of a year. So 10 or 15 days will take times maximum to control your blood pressure, is uncontrolled blood pressure or uncontrolled hypertension. If you control that, and you can take the injections. It's a life-saving thing. Each and every person should take whenever they get the chance. R N Tagore Hospital has got a very good facilities for these injections. They can come, they can register on spot, and then they can take their injections. It hardly take any time, but yes, this is a life-saving. Especially those who are 60 above or 45 above with the comorbidity, they should take, they should not avoid these medicines. Thank you very much.